legislator, you're the perfect person to pick your brain on this. So, what are your thoughts on these title protection laws? And I'm curious if this is something that has come up in your home state.
Sure. Well, I think this is actually extremely important because with scope creep and scope expansions across the country, from physical therapists, now optometrists want to be doing dermatologic and cosmetic surgery,
Right.
dentists wanted to be doing cosmetic procedures, dental hygienists want to be dentists, and so on and so forth. It's just going with all different groups and within medicine as well. So transparency is the best way to hopefully kind of help the patients know who is actually treating them. And that's what these laws deal with. They try to establish the basically they establish that if you say you're a doctor, you got to make sure that are you a doctor of nursing, are
Mhm.
you a doctor of medical science, which is what VAs do, or are you a physician? And so the laws attempt to protect those titles and make patients know who is actually treating them, because it is vast majority of patients see someone in a white coat, they assume they're a physician.
Absolutely.
And so it's a real problem. And I am working on that. We do have bills on that in Missouri legislature as well. And I'll be working on that next year to try to get it across the finish line.
That's wonderful. It's really incredible that, you've dedicated so much of your career to this. And I totally agree. I trained on the East Coast and grew up on the East Coast, and then moving recently to Las Vegas, this has become more of an issue where patients truly, genuinely just don't know who's treating them. And, we try to really emphasize transparency in our practice. And I think, nurse practitioners and PAs have their roles, but we do have to be transparent with the patient of who's actually treating them. So thank you so much for your work and your advocacy.